So we have a beautiful woman in front of us that has lost a lot of volume in her life, and he looks a little bit sad right now. He has lost a lot of volume in here, nasolabial fold, labiomental fold, a thinning of the lips, okay, barcode wrinkles in the upper lip, okay. We have hollowing of the nasojugal groove, okay. We have a long distance between the lower eyelid and the cheek, okay. And we have a very flat eyebrow, okay. So she comes to me and she asks me what we have done, and what we are going to do is we are going to correct the nasolabial fold, we are going to correct the labiomental fold, we're going to expand a little bit, you know, the lips just a bit. We are going to correct nasojugal groove, okay, and we are going to lift the eyebrow, okay. And after that we are going to do some Botox treatment in the upper third, okay. When you are performing both treatments, you are combining them, it's always important to do the Botox at the end, okay, botulinum at the end, because it should stay where you are placing it, okay. So problems arrive when you do first Botox and then do the fillers, because you can be displacing what you have been putting, okay. So I just need the materials. What materials are we going to use? What do we have?
Yes.
Så jag känner igen dig.
I think we can also. She's an excellent candidate for fat grafting, okay. But unfortunately, she didn't came yesterday. But I think whatever we do on her face is going to look great, okay, because she has great potential, and I'm going to try to enhance a little bit the zygomatic area as well, just a bit. Nothing massive, but everything a little bit. Okay, fantastic.
What do you need?
All of them.
Ta den som går ner så långt bak. Jag tycker vi ska flytta stolen. Ja, ta den nära den andra spotten där.
Okay, so I'm going to try
Nästan
this
fram
new
med den.
material. Okay. Have you got any ice available?
Och lite is.
Krossad is i en handske, plasthandske.
Du kan lägga det i en plasthandske.
Yes, if you want to help me, I'm happy.
Which did you take now?
Intense? Yes. I think I'm going to correct a little bit with this. This is the first time I'm going to try this material, so always try it in places that are more prone to forgive. Okay, so I will start with the nasolabial fold treatment, regular treatment, just to feel how it's the viscosity of the material and how it pushes upwards the tissues. Okay, put some gloves. Okay, so have you got the ice? Is the ice available?
It's coming.
Okay. So we will be doing some corrections in someone that has never get an injection in the face. So we should be doing as much as we can to avoid that she feels any pain. So if we have the ice, it's better. But we will start. Okay. So this is the standing of ACDC. Okay, ACDC stand. You have, you know, your center very low, you know, you're very ready for the injection. Okay, so the important thing is that you are comfortable, she is comfortable, okay, And as I told you, you should be starting at the midpoint of the nasolabial fold, okay? You just kind of tease her a little bit. I'm making some pain in here so she doesn't feel the puncture, and there's a way of avoiding that she feels the puncture is that I don't puncture the skin, but the skin punctures my needle, okay? So that's one of the techniques that I use to avoid her feeling anything, okay? Just very tiny amounts, okay? And the idea is to avoid excessive pressure, okay? And to avoid to lose material outside of the skin, okay? So you start going upwards again, and this is another technique, okay, which is like the trimming technique to avoid pain, okay? It's a lecture that I give about pain management that I didn't have the time to give, but one of these techniques is that, like, if you're using the proprioceptors of position, vibration, you tend to maintain the highways of information to the brain used with another signal, so the pain doesn't arrive to the brain. So
Now you have the eyes.
okay, and the eyes is another thing that is using the highways, so it helps her to focus on this. So another activity, so she's not focused on what I'm doing, she's focused about the eyes she's feeling in the cheek. So I was telling her, okay, if I work in the left hand side, you apply this on the right hand side. If I work in the right hand side, you apply this on the other side. So grab it yourself, and this is your duty right now.
Okay.
Okay? So I'll just go to the other side. Just small amount. At the beginning, you know, you don't have to stress yourself with the vibration, because it's something that not always comes very easily, okay? So you should be more worried about placing your filler in the correct area. What I was telling you about treating, you know, this triangle is that you should always be removing the needle, okay, while you are injecting, and never stay inside there, okay? So she needs a lot of volume, so we will be doing this for a while. Near the mouth is always more painful, okay, and this is the fanning, okay, thing that we do. Okay, so we put a little more on this side than the other side, so switch the eyes here, okay, and I think we have some sort of correction that we are liking a bit more. So give me another one identical to. So I want her to suffer the less possible. Was it too painful?
No, it's working.
She has, we applied like a topical ointment for like half an hour. So I think we still have a lot of folds in here. So we did a first pass, and right now I'm going to try to expand a little bit this area. So you always are asking her to smile. Smile. Okay, you have to clean it very well. And this one as well. Okay. And you have to be analyzing the face, you know, with tension, and we really need some more expansion in this area, so we will be like changing the vectors, okay? So you have, if you continue to fill in the wrinkle all the time, of course you're going to be placing more and more material, but if you give extra structural support by changing the direction, if you are applying the correction, you will obtain something over that, Okay, so small amounts of material, okay, that you are sort of seeding in different areas. Okay, so you give an extra support here, and then you go to the other side. Okay.
Va?
Okay. Fantastic. So I'm gonna just change a little bit the vector to give some additional structural support to this area, which is something that it could be done. This maybe it's easier to be done with cannulas, okay? Because we are not going after the wrinkle anymore. Okay. And I think I'm gonna get a little bit into the oral commissure right now. Always from outside. Open your mouth just a little bit, and I'm going to just get inside there. Okay, this is a little bit painful. Small amounts, and I'm just going to go a little bit upwards right now to enhance the treatment. And I'm going to do the same thing on the other side. The eyes goes that way. So just go and reach the angle over there, and you reach the angle over there. Okay. And we will leave her for a while like that. So right now I think I'm going to use the other one, the Korea Essence.
Excuse me, the total volume now is 4 ml.
No, the total volume is 2 ml. 2 ml. Okay? 2 ml. So I think she needs some more volume in the lips. Okay? So I'm gonna make a very easy way of numbing the lips. Okay, she has already the effect of the cream, but I'm gonna numb them over that. And it's like, don't be afraid to do that. Okay, you have to be comfortable. Okay, so we will do this vesicle in here. Very, very superficial. Okay. You have to have some sort of blanking over there, blanking. That's okay. Okay, it's enough.
Essence.
I need a 25 gauge needle. Maybe this one is 25.
That is 30.
Okay, it's no problem.
25. Here.
Okay, so let's say we have just put a cannula, 25 gauge cannula, okay, and we are going to be pushing a little bit material side because we have to clear the air column that we have. And I have a 30 gauge needle, I think. So this needle is smaller than my cannula. So I really need this dancing needle movement if I want to enter with this cannula. Okay. So what I was telling you is that you should enter perpendicular to the entry point. Okay. Once you have enter, you just switch and you change, you know, the level of that you are advancing. Okay. And you just try to be as gentle as possible with the mucosa. Okay, because she will feel that. I have just gone all the way to the other side. Okay, and you can do two techniques. One technique is to use both sides. Okay, and the other technique is to use only one side. Okay, and if you use one side, this is a technique that is called the hook and worm technique. So you grab the lip as if it was like a worm, and move it all the way until there, okay, and you inject it just following, but it's more difficult, so I prefer this one. Just be very gentle, very small amounts. She didn't want to touch her lips, so I'm gonna be very, very conservative. I promise you that. Okay. So I need the same entry point to do the upper lip. Okay. So I'm just gonna go once again inside there. Okay. And I'm penetrating the skin. And I'm getting into, you know, and sometimes you can get superficial. If you get superficial, it's going to be extremely painful, okay, and it's going to get like stuck. It won't be dancing. So what I need you to do is that you have to play a little bit, okay, like just reaching where you need to reach, okay. With the cannula, it's always important not to get frightened, okay. Just have to reach the target area, and then you just start injecting and removing and injecting and removing in very, very small amounts. Okay, you're just putting a very tiny column. She wants a very natural result. That's what we promised her. That's what we are going to give her. Okay. So, we do exactly the same thing on the other side. We just ask her to open a little bit her mouth. She has been very good to us, very good patient. And I just do a small blevins there, just that is enough, okay. And once again, go inside and go for the dancing needle that I really need, because this needle is a little bit smaller than the cannula, so you just play a little bit around with there. She doesn't feel that at all. So put that back again, and then you enter once again perpendicular, okay, and once you have done it, hopefully you just move. I just go out. If you have some minor bleeding, of course you're not going to be able to see where to enter with the cannula. So just, you know, clean everything again until you're able to do it. And if you lose, for example, where you're working, just come back with the needle again and do it again. Never fight with a cannula. I have to clean a little bit, and always enter perpendicular and then move. Okay, be gentle, very gentle, and just like you can move like this, and it's gonna just reach past the half portion of the lip.
You don't push, you're just turning it around.
Well, you can do both, okay, as soon as you control where your tip is, because what is working, what is making the job is the tip of the cannula. So I really need to be a little bit more towards the center, and I need an extra push, and I'm going to do it right now. Okay, I obtain it. So I just start injecting and removing. Okay, she has very thin lips, very atrophic mucosa, so if you put too much, it's going to show. Okay, so right now I'm gonna go for the upper lip. from the same entry point. And I need once again the needle. Okay, no, I'm fine. And you just go all the way and you ask her, breathe. Okay, and when she's breathing, you go a little bit more, okay? And then you reach mid portion of the lip and you just inject a little bit and remove a little bit, inject a little bit and remove a little bit, okay? So that's just a tiny restoration, okay? And I think we are done with the cannula by now. I'm gonna keep this because we are going to perform the treatment in the nasolabial group region, but I would like to show you something before.
Excuse me, do you give her any pre-medication?
Well, if she has some sort of herpes history, I would do that, okay? And if mainly that.
No pain medication?
No, before no. I always after the treatment, I always make the patients drink San Benedetto green tea, okay? Very cold with 500 milligrams of acetaminophen or paracetamol, always. If the patient doesn't accept it, he will still take the green tea, so he will have some diuretic effect or whatever. But they like that. Okay, so, well, we have a lot of ring cleaning here, and I think we should give some sort of treatment over there, but I think it's going to be a little bit painful. So just to avoid that, I'm going to give her an extra anesthetic in here. Just a little bit in here, a little bit in here. Okay. A little bit in here. Which would be like abbreviated anesthetic for the lips, okay? If you don't want to do the infraorbital block, you can always do small vesicles all over, okay? And it's gonna work. Okay. I just want to improve a little bit this wrinkling. You have to be very careful. This wrinkling, they don't forgive that much, okay? So very small amount, okay? Under correction is better. Okay, I want another one of this one.
Essence.
Yes. Was it too bad?
No.
No? Please, this is the worst part always, huh? Fantastic. Okay. So, just thinning a little bit, not that much. Okay. And I think she's gonna benefit from this. What I was telling you is about the philtrum, okay? Is that you enter in this point, it's very painful, okay? So you are like making the columns, okay? And at the end, before coming out, you just push a little bit in order to make a volus in that area, okay? So you get an extra rise, okay, in that part. So you will do the same on the other side, okay? Just go, put this philtrum, and before coming out, just give an extra push in there. Okay, and that's enough. Okay, very subtle, nothing. And I'm going to show you something that I call the Mona Lisa effect. No, Mona Lisa smile. and it's not my invention, it's a colleague of mine from Rome. So you need the turning to be 30-degree angle, more or less, to be able to perform this correction, okay? And it's very useful when you are restoring the mouth for the commissures, okay? And it is based in placing 2 columns in the oral commissure, one internal, one external, okay? So actually what happens is that by placing these 2 columns, when you close the mouth, the columns, they make like a train rail, okay? And they have no space for the filler to be placed, so everything goes up, okay? It's very nice. And it has, it consumes very low quantity of material, so I'm going to show it to you. I think you may like it. Okay, open your mouth. Okay. So you go from external, okay, upside down, okay, and from internal, okay, downwards, and you place a little bit of material, okay, and you ask her to close the mouth, and that is like Mona Lisa smile effect. Okay, so yes. Okay. And we are going to do the same stuff in this side. Okay, so we are moving upwards on the outside and grab both sides. We are just putting a rail over there. It's okay if it comes a little bit out. And we are going to do the other one. Should be going backwards, but it's very uncomfortable for me to do it, so I'm going to do it upwards anyhow. And I'm going to be delivering a little bit in there. Okay. Just close the mouth right now. See? That's its effect. Okay, so it's rising from the inside, you know, the mouth. Okay.
Går det bra?
Is it okay? Okay.
Ser det bra ut då? Ja.
I need some ice. Put some ice on the lips.
Tack, skönt att höra.
Nu får jag lägga lite i så du får inte prata. Tyst. Det blir bra. Det blir lagom. Det är för kallt säger du till.
Okay, so we are going to start moving upwards. You know, the lips are not bigger at all, okay? Just a little bit firmer, that's it, okay?
Men det behöver du inte oroa dig för. Det är jättesnyggt.
So we are going to start filling these areas, okay? And I think we should access through here. Just over there. A little bit of local. Okay. Well, you're going to see what happens when you use a bigger needle. The difference that you don't need to dance around. Okay, it just, let's say we use a 22. Okay, and then we just enter here, and it's super easy. Okay.
25 or 27 gauge? What do you need? What are
There
you
was a
using
22.
now?
22.
That one?
22, that
Yeah,
one,
yeah,
and this
that
one
one.
is 25.
Okay.
Okay, so I just go over, okay, and when I have overlapped the infraorbital nerve, I just protect the orbit and change and go towards the orbital floor. Okay? So if you want to see where I am, just put your finger inside. Don't be afraid, just put it over. Okay? Okay, it's very, very deep. Okay? So I'm going to be injecting and removing, and then I'm going to go a little bit upwards again. Worst case scenario, I scratch a little bit the infraorbital nerve and it gets numb for 3 months. Okay? Never happened to me before, but that is the worst thing that could happen with this technique. Okay? So very small amounts of material, and you remove it and then do it over again, and you just go grab the tissues, and that is the malar septum. Okay, we are a little bit affecting the zygomatic facial. Okay.
Är det obehagligt eller gör det ont? Det gör ont.
A bit more should be good. Okay. Breathe. Okay. Fantastic. Breathe again. Okay. Sometimes you get into fibers that are very elastic, okay, so they don't allow you to get to the correct place that I want to get. You have to keep on playing a little bit. Okay, right now I'm where I want to be. Let's say that you have finished this, so you can actually remove it, maybe like that. Okay. Is it okay? Just put the
Where is the cannula?
more ice. The cannula is inside.
Okay.
Sebastian, are you shooting your periosteum now?
I'm just, yes, I'm just scratching a little bit the periosteum. That's why she feels a little bit of pain, okay? And I want to just reach the outer part of the eye right now. So I'm just like dissecting very gently the tissues, okay? And enhancing a little bit the outer of it right now. Okay, and then I move backwards, and I'm a little bit more superficial right now, you know, but you don't quite see the material coming. I mean, it has to be very, very tiny amounts of material that you put. Okay.
How far off are you now?
I'll let you see.
Can I?
Yes.
Yeah.
No, I'm
Yeah,
here.
I
More
feel it.
here. More like here.
Yeah.
See? It's like, it's not pain. It's like the patients, they feel a bit like nervous because they have something very close to the eye. So that's pretty much it. But it's absolutely terrible. Pain is not that bad. So you come out and you see what happens, and you ask her to smile. Please smile. Smile. So see the difference between one side and the other one. So just do corrections in both sides, and then see what's happening and what can be done better. Okay. So we'll be doing this. So always advance perpendicular to the skin, okay? And if you have problems, just go back and do it over again.
normally are you using Pallon here?
Well, depends. You know, I would use Perlane for the lower part. I would use Restylane for this Nasolabial group. Depends what I have available. Okay. So see, you have to interrupt sometimes some fibers that are not as easy. Okay. Very different. Okay. See, you have some sort of resistance that you have to be able to, in order to be able to achieve the correct plane. Okay? I'm a little bit superficial here, but I just want to put some amount of material very deep. Okay. Okay, have some more expansion there. Get out, see what happens. Go from the other side. Okay. So as soon as I get closer to the eye glove, I have to always be considering to protect. Okay, with the other hand. Okay. So I'm very deep. Have some correction in there. This is gonna look better tomorrow, and it's gonna look better even the day after tomorrow. Okay. So just be very kind with the cannula. Okay, I'm just gonna reach the outer portion of the eye right now. Okay, perfect. Okay. Please smile. Okay, just see what happens. Smile a little bit. Okay. So you see that they're still very sunken in this area, okay, and this area. So I just need to put some more in here and in here, okay. But now I'm going to be a little bit more superficial, so it's going to be a little bit more complex. It's going to be a little more risky. So I just have to be very careful with the amount that I release in the superficial pattern. Okay, so I'm just going to be much more superficial. You see the canal, okay. So the amount of quantity that I'm leaving in there, it's very little, okay? Very little, okay? And I just move. Okay, very little. Right now I'm going to the other side. I'm going to do exactly the same thing. It's going to be very superficial right now. So by being there, I know that I put too much, I'm going to do some sort of nodule, so I don't want to do that. It's getting better. Okay. Smile a little bit. Yeah. Okay. I think I can still put a little bit more. I'm going to put some more deep in the inner part.
Essence or
No, the same. I'm still have. I've been putting. I have been putting very small amount.
Jaha.
Vi har använt det länge nu.
Ja, ja.
Under ögonen. Inte ens att det är för tjockt.
Okay.
Ja, jag behöver en essence till. Nej, jag har.
Okej, jag hämtar en sans till då, om du använder den där.
Vad är det?
It hurts.
Okay. I'm sorry, I have to be very deep for this. Okay. Very close to the angular vein in there. Okay, I'm scratching the orbital floor. Please smile, smile. Okay, we will leave a little bit more ice if we can have it. We good. And we will be using this just to place what we have left over here. Same entry point. Okay, just to feel this from a different area. Okay. Just put some more ice in the lips. I want you to put some ice here. And I need one other of these ones. So, essence. Well, to conclude, we are going to enhance a little bit the eyebrows. Okay, so we need to augment this part, absolutely, okay? So I will just do a small level here, just to get inside. And I will do some local here, okay, exactly in the exit of the, okay, supraorbital nerve. And I'm going to do a little bit more local in the supratrochlear area, just like that. Just a bit, nothing exaggerated. It's going to allow me to work with no pain. It's going to be, I think I have been not too good to her. I could have done it with less pain. Always enter perpendicular, okay? Just go for the entry point, okay? And then just try to reach the target area, okay? So let's say we want to augment, okay? And you always have to be controlling, the end point of the cannula, okay? So we are not quite where we want to be, so I just have to push myself a little bit forward and to treat this like a accordion. How do you say the instrument that is part like this?
In Swedish dragspel.
Okay, she doesn't feel pain. I'm happy. When I'm happy where I am, okay, and it's important to arrive here, you just start pushing and removing, pushing and removing, pushing and removing, pushing and removing, pushing and removing. Okay.
Subcutaneous? No.
Well, you are in a deep subcutaneous tissue, and just before coming out, we enter once again. This time we are a little bit lower, closer to the eye glove, and we try to do the same thing, but from below. Okay. I think this can sometimes get a little bit obstructed. Yes, it does.
Det är det som hände mig igår. Det är det som hände mig. Jag tog stopp med sprutan.
So you are starting to see some effect here. Okay. But I think over here we are missing. Okay. So we really need to get to there in order to obtain a natural result. But if this canal is a little bit shorter than what I like, so you have to really push yourself to get into the area that you were going to treat. So just get all the way, start filling and removing. Well, she was lacking a lot of volume. So, could you please raise your eyebrows? Okay. Okay. Okay, relax. Okay, I think she may be needing something in there, and then we're good. Just a bit, not that much. Okay. This is a fuller eyebrow and a little bit higher. We have been raising it like 2 millimeters, more or less. Okay, so we will do exactly the same on the other side. If you have any questions, just interrupt. Okay, this is for you. So it's always better to just do different passes and not to just put the material in one with one pass, because it can.
Oh, sorry.
Relax.
What happened?
Oh, I was too close.
Okay, so you can totally feel, you know, the supraorbital nerve. You just enter there, put a little bit of local, and then you feel the supratrochlear area, and you put some more over there. That would be enough. Okay. So you enter always perpendicular to the skin. Okay. Once you have overlapped the skin, you just go searching for the area that you want to treat. Okay. And always be gentle. But you have to really squeeze this until you get to the middle part. Okay. Just like that, all the way. And then you start injecting and removing. Okay, I think we need to get a little bit upwards. Okay, of course, she has done several fillers today, so I would recommend corticosteroids for her. Maybe one shot of betamethasone, 4 milligrams, just for today. That would be good. Okay. Always push yourself in a position that you are able to assess the changes. I think that we need a little more Much better. Much better. Just open your eyes. Okay, there's a little bit of asymmetry here. You know, this one is always a little bit
It's
higher.
always been like that.
Higher.
Yeah.
Okay. So I think some, like a column over there, would do a lot of work for her. So I'm just gonna use one more. Have you got any ice left? Just all the time with the ice. You have to do the homework. Eh? Okay, so I really need to assess this. I'll be moving a little bit. You can do like 3 passes, one definitely above the eyebrow and the other 2 below the eyebrow, so you can get an extra push of the structure towards the cephalic. Okay. Okay, I think that is enough. Okay, so it's very elegant to have this, I believe. Okay. Her skin is not elastic at all, okay, because she has been exposed to sun forever, okay, and she has never put creams on herself, so it's the kind of skin that tends not to receive that well the fillers, okay, because it's like the distension of the skin is not as you would like, doesn't follow that well, okay, so that's why this kind of treatments, they do look better in this type of skin in time, because this will be releasing water and be exchanging with water, so it will hydrate the whole skin and will look a lot better.
With stem cells, can you
Yes.
do it better?
Well, I would have loved to do a fat grafting for her.
Skin, I mean the skin quality, can you,
Okay.
I think it could
Well, whatever you do for this skin is going to improve. Whatever. Just if she puts Nivea cream in her face, it's going to improve. If she does, you know, bioplastics or whatever, it's going to improve. If we do lipofilling over her, it's going to improve as well. Everything, whatever you are going to do, is going to make it better. I just want to see her a little bit from how far she has to put everything outside. Okay, please smile.
Say
I
something
really,
funny.
I really
Something funny.
that's what I do. I always am shooting stupid things. So I really like your face when you smile. You're much nicer and prettier. So what I'm gonna do with this is I'm gonna enhance a little bit the zygoma. Okay. Always entering from the same point. Okay, here. And we are going to just show you what I was telling you about the malar septum, okay? See? See? Okay. This is the malar septum, okay? I said a lot of stupid things, but this one is a good one, okay? So just, if you do like this, you know, just you have to trespass it, okay? So grab the tissue and just go for it, okay? And it's very fibrotic, especially in photo-age skin, okay? And male patients is very fibrotic as well. So you have to trespass it in order to be able to reach the target area, okay? Which would be this one, okay? So I would like a little bit of augmentation over there. And I will come back again, okay? And I will do a little bit of augmentation in there. Maybe I did it too fast. And I will do a little bit of augmentation like this. Okay. Just enhancing a beautiful feature that she has, because her face is a little bit long rather than wide. So I'm enhancing the bizygomatic diameter of her face. And that's why I think she will look a lot better. But see, if I don't look for a point of less resistance, I can bend the cannula totally. So that's why these treatments are always done with a stronger cannula. Okay. Okay. So I need just one last one. Please smile a bit. Smile. Smile. And I need the botulinum toxin. No, I will use this one. So this is not really a volumetric material for cheek augmentation or zygomatic augmentation, but we are using it because I really want something soft in her. And okay, so I'm going to put this in the same place as to the other one. So I just pass the malar septum, get all the way until place that I want to give the correction. And I'm going to be a little bit more superficial because this is not really a high volume product. So if I want to see some effect, I want to place it not that deep, okay? And, okay. I'm just making her face look a little bit happier. That's it. I should have designed her, but we wanted the pictures to be beautiful, so I just didn't want to mess her face. Okay, I think she has done enough for us today. For her. Your skin is gonna be much better, okay? That's a promise. Okay, so you have to hear a little bit the skin. So can we place more hyaluronic acid in here? Yes. Would it be correct to do it today? No. Why? Because the skin is very inelastic, so it won't follow, okay? So maybe she comes back in 2 weeks, 3 weeks, or a month. The skin will be much better. We will be able to place more filler in a superficial way here to enhance this correction, okay? But the correction she has today is as good as her skin allows us to work today, okay? So depending on the quality of the skin that you have is the things that you're able to do. And I'm going to do just Botox treatment, even we haven't explained it yet, but just to do everything for her. Have we got the botulinum toxin or not?
We have somewhere.
How many fillers did we use at the end? Does it come? Yes. Okay.
3 intense.
So 9.
Han får väl blanda själv, jag vet inte.
9, and I'm looking so many things that I would have correct with the fat, you know? Just send me a piece. See that one? See that? So if I want to project a little bit more of this, okay, it's useless to put all the volume in here. Why? Because she already has nice cheekbones, and if I put everything in here, she's gonna look like a lion, okay? So if I want to push a little bit forward, a little bit upwards this, I have to feel the buccal fat pad in her case, okay? So this structure will hold and will hang in another structure that is pushing this upwards, okay? So that's why if I want to continue to enhance zygoma over here, in order to maintain femininity, I have to be able to connect this augmentation with this area, okay? So you will be feeling that, and the effect will be this one, okay? So the oval will be almost perfect, okay? I could as well augment the temporal region in here, something we could do, but I think it's the first time for her, and we have been abusing her patience. Okay. And the Botox.
I haven't done anything to it. I don't know. There's
Okay. Have we
1
time?
milliliter is the bigger one here.
Fantastic. Okay, I'm gonna take it. It's Vistadev? Okay. So it's
Ja, nu är det fast. Det är ruinerat. Det är beroende. Ja, det
Du ser ju 10 år yngre ut. Det är bra investering. Det är bättre än att köpa gardiner.
Ja, det ser inte ens kameran.
Nej, det ser det.
Du slutar ju med gardiner och allt annat.
Det blir ingen resa med utomlands. Det blir till det.
just preserve this one in the cold. Okay. So to end the treatment, we are going to put a little bit of botulinum toxin over her. Okay. With botulinum toxin, always less is more. Less punctures is better. Okay. Less doses is better. We are going to talk about that later. So we want this to go up. Okay. We want this to be a little bit more loose. We want this wrinkling to go away. We want these wrinkles to improve. Okay. So we have a double belly here. Just go up with the push this upwards.
Jaha,
Okay.
sorry.
Again. Okay. Release. Again. Okay. Release. Again. Okay. Do some smiling for me with Chinese eyes. Okay. And please become angry with me, like very angry. Okay. Okay. So
Kan inte så här.
she is very solar person, you know, she tends to laugh. So what are we going to do? The same pattern here. So very high, almost just getting in. 1, 2. A little bit lower to the central. 1, 2. Okay. And I really want to help her with this wrinkling she has over here. So you can totally go downwards, okay? But if you start applying toxin in this part, there's something that is called zygomatic major muscle, which is responsible of moving this structure. So if you're going to be placing your punctures in this area, you have to be pointing upwards. It has to be very, very superficial, okay? So it would be 1, just like there, okay? So I'll be placing a little bit here, very superficial, okay? 1, and look upwards, okay? She has a very nice tonicity over there, so I'm gonna place a little bit of toxin right down there, okay? Just 1 unit is gonna be helping her in this part, okay? If the tonicity was bad and I would have done that puncture, she would have an ectropion. So as contraindicated in this case, in the other case. And I'm gonna give 1 additional shot for her. So I need 2, 3, okay, just 3. Okay, so I'm gonna be doing the same stuff here. Just you can do 1 shot or 2. I prefer only. That's why I prefer, you know, like the servings that are 0.3, because they are softer. You know, these ones are harder, and so you have to be very precise, if not a lot comes out. Okay? To end, I'm gonna do an advanced treatment. Please clench your teeth. Okay? Clench them like this. Okay. So you have the master, okay? The anterior insertion of the master, okay? And in the anterior part, 1 centimeter towards the anterior insertion of the masseter, exactly there, you can puncture intradermically to obtain an effect on the muscle that is the depressor angulis oris. Okay, so this will rise a little bit more as well. Okay, and just on this side, same stuff. Punch your teeth, just anterior. This muscle is has insertions that go inside the dermis, so it has to be very superficial puncture. That's it. Okay. If she has some wrinkling in here, like this, no, this is fine. This is perfect. Okay, I think she deserves a clap. So moisturing, yes. Some sort of cream would be good, only in the lower part. Okay, just like this and that. Okay, something like that. Moisturing of the lips, especially because they are a lot more exposed to the external atmosphere now. And no massage in the upper part. Okay, no massage of the eyes of the botulinum toxin. Okay, the toxin is going to start acting after 48 hours. Okay, and the fillers, you can already see the benefit. Okay, I was very conservative with your mouth. Okay, but it was impossible not to be treated because it was a disaster.
Thank you.
Okay.
Du ser väldigt bra ut.
Jättenaturligt.
Titta hit, mamma.
Eller en.
Nej, jag måste ta det. Mycket naturligt. Så du rörde på det.